Hello, ladies and gentlemen. Welcome to another edition of Microbiotics Bio Talk. How are you guys? Hope you're fine. We're back again today to continue our Bio Talk on the National Strategic Health Development Plan. Last time we gave an introduction to the strategic pillars and the priority areas, and as promised, we are going to be looking at the individual priority areas, and then we'll be able to break them down and talk about the indicators, whether we have been able to measure up and whether we've been able to put some of these indicators, whether we've been able to fulfill some of these indicators as a country and as individual states. So the first priority area that we'll be looking at is leadership and governance, and this is highly very important. It has been discovered that governance in health is a very, very salient theme for developmental agenda. And in fact, leadership and governance in our health systems has been discovered to ensure that strategic policy framework exists, and that they are actually combined with effective oversight, building of a coalition, regulation, and attention to system design. In fact, it has been linked heavily with accountability, because the need for greater accountability arises when funding is involved, and when there is a growing demand for results for all these health programs and interventions that we have. So, and governance in health is actually a cross-cutting theme, and it's intimately connected with issues surrounding accountability, as mentioned earlier. And in the context of health system strengthening, it is an integral part of health system component that has been discussed earlier in the handbook for the National Strategic Health Development Plan. So, and basically there are two indicators. There are two indicators for this particular health system governance, this particular priority area. And the first one is a rule-based indicator, which measures whether countries have the appropriate policies, the appropriate strategies, and approaches for health system governance. And this indicator, for instance, they are part of the larger class of indicators that are referred to as governance determinants. And in addition to the existence of rules, which are referred to as formal procedure, the determinant of healthcare provision governance also include 4 other broad categories, which include ownership arrangements, decentralization of healthcare, stakeholder participation, and of course contextual factors. The second indicator, the second type of indicator that are being used is the outcome-based indicator, which measures whether these rules and procedure that has been stated above are being effectively implemented, or enforced based on the experience of relevant stakeholder. And outcome-based behavior relate directly to the functioning of a lot of health system building blocks, and this is to kind of support and in a way monitor the rule-based indicator for measuring health system governance. So they kind of work hand in hand. So the rule-based are to do with whether there are policy that are on ground, and the outcome-based are for whether these policies and procedures are being effectively implemented and enforced. So, and of course, when you are selecting indicators for measuring governance in health, an high value are placed on their usefulness and relevance. No, they are not just not all indicators are believed to be relevant or useful in some states and not in all the countries. I think that one is actually explainable enough. But despite this, the most suitable governance indicator may be unable to predict whether developments in a country or a sector can be attributed to a change in governance. So, so based on this, what are the core indicators that we have? What are the indicators that are used in measuring this priority area, in measuring the effectiveness of this priority area? So before giving this indicator, let's look at how this thing works. So the indicators assess whether countries or states have policy, regulation, and strategy in place to promote good leadership and governance in the health sector. But it does not aim to assess the enforcement. So if it's there, it's believed that it will be enforced. And the way these indicators are being used, that each indicator is given a score of 0 if an adequate policy does not exist or cannot be assessed. And it will give a score of 1 if the adequate policy is available. So we have 10 rule-based indicator for now in the National Strategic Developmental Plan, and these 10 are going to be the one I'll be talking about very soon, or just immediately after now. So the first indicator is the existence of an up-to-date national health strategy that is linked to national need and priority. There are national health strategies that are linked to national needs and priority. Is it existing? Is it updated? It's not just to exist, but to actually be up to date as well. The second indicator is the existence and, of course, the year of last update of a published national medicine policy. National medicine policy. There must be a policy for the medicine, the drugs that are circulating within the country, and it has to be up to date as well. So the third one is the existence of policy on medicine procurement that specify the most cost-effective medicine in the right quantity, and this policy must be open, and competitive bidding of supply of quality products must be put in place as well. Then the fourth indicator is the existence of a national strategic plan for tuberculosis that reflects the 6 principal components of Stop TB strategy as outlined in the global plan for Stop TB from 2006 to 2015. The fifth indicator is the existence of a national malaria strategy or policy that include drug efficacy monitoring, vector control, and insecticide resistance monitoring as well. These are actually very self-explanatory. The sixth indicator is the completion of the United Nations General Assembly Special Section National Composite Policy Index Questionnaire for HIV/AIDS. There's supposed to be a policy also on HIV/AIDS as provided by the United Nations General Assembly special section. Why am I saying special? I'm not from Ibadan. All right, so the seventh one had to do with the maternal health. So there must be an existence of a comprehensive reproductive health policy consistent with the International Conference on Population and Development Action Plan. This policy must also exist for under this priority area. It's an indicator for this priority area. The eighth indicator is the existence of an updated, comprehensive, and multi-year plan for childhood immunization. The regular ones that people go for at the hospital, at the health centers. This policy must exist for multi-year. It's a plan that must involve a lot of years in advance. And the ninth one is the existence of key health sector documents that are disseminated regularly, such as budget documents, annual performance reviews, and also, like we're discussing now, health indicators. And the last indicator is the existence of mechanisms such as survey for obtaining opportune client input on appropriate and timely and effective access to health services. So before health services can be actually effective, timely, and appropriate, there must be mechanism such as survey, which we allow the best mechanism to be put in place. So these are the 10 indicator for this priority area. Priority area number 1, leadership and governance. So if this policy are existing for each if these indicators are to be graded by this indicator, each policy must be present to have a score of 1, and if they are not absent, we look at we have to score a 0. That's very straightforward, Abby. So very soon, and I think we'll be bringing people on the show very soon. Somebody who has been at the forefront of some of this priority area. So to actually use the indicator to score. Yeah, we're going to look into that to actually score ourselves, so that we'll know where we are. And what still need to be put in place. Like it says, are these rules and policy, are they available? If they are available, are they being enforced? So till that time, make sure you stay alert. Follow us on BioTalk. Don't leave us alone. Stay tuned till the next time, and also make sure that you stay healthy. It's very, very important. Stay healthy, and God bless. Bye.